This is a video lecture for HKIN226, Focus on Personal Health at St. Francis Xavier University. This is video 2 specifically in our series on weight management. This video deals specifically with weight management strategies and then extremes in weight management as well. What can we do to achieve a normal weight? For most people, the goals associated with achieving a normal weight are to lose weight. The large majority of people tend to have gained more weight than they would like and need to address this issue in a negative direction, more specifically. So the first thing that can be done centers around diet and eating habits. And there's a lot that can be said here and a lot of tips and tricks. This is just going to scratch the surface, but above all else, negative energy balance has to be established in order to use the excess fuel that your body has stored. So that specifically means, in terms of diet, that you have to eat less calories, eat fewer calories. The intake of energy has to be reduced. This can be done through a few different ways, and probably the most common error that people make is to not pay attention to portion size. It seems that the average person will underestimate portion size by 20 to 25% because they don't know what a portion should be. And nowadays portions become so large that we expect our normal portion sizes to be larger than they should. This also brings up the idea that often there's no consideration of portion size when foods are considered to be healthy. Some foods are healthy but still very calorie dense and contain a lot of energy. Portions do have to be taken into account even in these situations when there are benefits of eating the food, but the downside is still that you're taking in a lot of energy. It seems here also that with larger meals, there's even a greater underestimation. We have a bias in place where when we eat a lot of food, we deny that it was really that much and try to underestimate even more. One of the situations that I notice where this happens for me is eating out at a restaurant. You tend to have a whole different perception of what is a normal meal size when food is prepared and placed on a plate for you. Something about the social setting and not being in your normal routine can really disrupt your attention to portion size. The only way to know, though, is with practice. Portion size isn't something that can just be learned through a PowerPoint, but has to be experienced where you measure the size of a portion regularly to get a handle on what that is. A second way that you can address eating habits specifically is to replace calorie-dense foods with nutrient-dense foods. And importantly here, with nutrient-dense foods that are also not calorie-dense. This goes to the last point that we just made. So examples of energy-dense foods are normally fat-containing things. Mayonnaise, peanut butter, chocolate, cheese, these are all energy-dense foods. An example of a food that is both energy dense and nutrient dense might be avocados or perhaps eggs. These are good foods that contain nutrients, but they also contain a lot of energy, so we need to be aware of how much of these foods we eat. Foods that are just nutrient dense but not energy dense are things like fruits and vegetables. So the classic tale that you've been told of eating more fruits and vegetables and less fat to manage your diet. It's also important to be in a regular, consistent pattern of eating. Your eating habits should be generally spaced throughout the day, multiple smaller meals, 4 to 5 meals. And the reason for that is that skipping meals or having too few meals leads to feelings of justification. When it's been a while since you've eaten, you feel that you can overdo it if you want to. And so overeating is often associated with prolonged periods of fasting when willpower gives out. Now, there is a lot of really interesting research in this area that I'm specifically interested in on calorie restriction and alternate day fasting, where there seems to be a lot of good evidence that fasting for one day and then not fasting at all, eating whatever you want to on a second day, and alternating back and forth between that pattern of eating can in fact result in a calorie deficit. It seems that if people fast for one day and then are given free rein to eat whatever they want to, they can't eat 2 days worth of calories in one day. Now, don't take that as a challenge. On average, that's what we've observed, or the research has observed. So there is some indication there that regular balanced meals can or should be the norm, but you can change that with the proper supervision and willpower. Of course, the second half of the energy balance equation is physical activity. Again, the key focus here is to initiate or maintain a negative energy balance. Expending calories to do work does just that. We increase the output side of the equation, and this has added benefits on metabolism, specifically where we ramp up metabolism, which might increase basal metabolic rate on, or even in times that we're not exercising. And this is specifically true with exercises that increase muscle mass, things like resistance exercise. Not only do we establish a negative energy balance, but we also get these benefits of improved cardiovascular health, improved mood, improved sleep, improved self-esteem, a sense of accomplishment, and so a whole host of other effects that come with exercise and not just negative energy balance. There seems to be some indication, too, that appetite isn't automatically upregulated. Even though you're expending more calories, you don't automatically eat more. But it doesn't mean that that never happens. Oftentimes, you'll have the perception that you deserve a treat or a break. And so that should be monitored fairly closely. We talked in the last video about how emotions and feelings towards food are very powerful. Often food will bring up emotions, and those can turn around and impact the desire to eat more food. So specifically, low self-esteem and negative, hurtful emotions tend to spur the intake of excess calories. And weight problems often arise from this loop in self-esteem and negative emotions influencing food intake, and then that in turn influencing negative emotions. We have this constant narrative in our head that compares what we've been doing to the ideal self. The self-talk is often self-deprecating. We would love if it were motivational. Ideally, I think it's realistic to shoot for something in the middle that's not always positive and not always negative, but that realistic self-talk that we've talked about before. Now, food we also use to cope. It's not only fuel, it stimulates reward centers. It's a social activity. We use it when we're bored. Think about the last time that you were at home and trying to work on a paper, but you didn't want to, and so you looked to see what was in the fridge. We use it just to alleviate stress or any problems that we have, and often it's unknowing. Often it's such a habit that we've ingrained that it's automatic. And so a key in dealing with emotions and being able to cope without food is to find ways not to use food to manage stress. Find the triggers and the things that prompt you to eat, and be realistic about them, identifying that it's not so much food that you need at the situation, but to address this topic or this problem. Now, in adopting these strategies, there are many different ways that you can go about implementing this advice. A lot of people try to do it on their own, and there are varying rates of success in doing that on your own. I think it's important first to establish the rationale for why you want to lose weight. Is it simply the number on the scale, or is there some other added health benefit? It should be a positive rationale. There should be a well-founded reason for why you feel like you want to reduce body weight. The general guideline, and there are ways to figure this out, is to lose 0.2 to 1 kilogram per week, or 1 to 2 pounds per week. And this is facilitated by a constant low-grade calorie restriction, always incurring a small deficit, not very abrupt low-calorie diets. Those generally result in relapse. Now, as far as diets and supplements go, normally they don't work. Both of them will make lofty claims. They'll oversimplify. It's too easy to blame fat or to blame carbohydrates or to blame gluten. There's no one thing that causes a weight problem. There's combinations, clusters of factors. One might be easier for some person to focus on and might help them motivate themselves towards their goal, but there's no one answer. It's important to seek books and to seek diets, supplements, etc. that advocate for balance. Not just buy this product, it's the one and only product. Not just cut out all fat because fat's the problem, but advocating balance, eating a balanced diet in moderation while also engaging in physical activity. And then on the supplement side, it's important to acknowledge that regulations surrounding supplements are very loose. There are few regulations, and over-the-counter medications are much more regulated. You can put anything into a supplement and then market it as something that it's not. Often there's no active ingredients. There's been a study that evaluated supplements just this past year that looked at whether they contained the active ingredients and in what amount. And in most cases, there were no active ingredients to be spoken of. So the point is that there are no magic beans. There's no green coffee bean extract or raspberry ketones, as your pal Dr. Oz would try to encourage you that there are. There is no easy solution. It takes persistence and motivation and a balanced approach. To that end, organized programs are really effective. Weight loss programs beat or are more beneficial than doing it alone in that they provide group support. They provide accountability. And that social aspect is what's lacking with the individual efforts. And there are commercial Weight Watchers, Nutrisystem are commercial, non-commercial support groups, kind of Alcoholics Anonymous, but Overeaters Anonymous is a non-commercial group. And now we're blending the two into online platforms where you have communities that allow for engagement and accountability. Here, these are absolutely key motivators in developing and in maintaining a plan. There's a lot more success in a group scenario than in a solo in a solo scenario. It's also possible to undergo surgery or clinically supervised weight loss. It's possible that you'd experience larger changes in situations like this, but it's often very costly. It's also very disruptive, and recovery, especially from surgery, can take a fairly long time. Surgery does prove to be fairly effective, though. Drugs can work in some situations. Normally, appetite suppressants are the drug of choice, but it can block fat uptake in the intestines and also fat-soluble vitamins, vitamins A, D, E, and K. Side effects are also cramping and diarrhea, so it's often not worth the reward of appetite suppressants. They usually are temporary effects, but sometimes this can help in very obese individuals where food intake is drastically skewed. In these same very overweight individuals, surgery can be a relevant option. Gastric bypass surgery has been very successful, and there's a few different examples of it, and we normally reserve it for people that are very overweight. But in simplistic terms, we make the stomach smaller. We bypass a lot of the stomach, which forces people to eat less because they feel full sooner, and we can do that either through manipulation of the path of the esophagus or by putting a band around the stomach that prevents it from distending. I'll show you an example of that here briefly. This is the Roux-en-Y gastric bypass surgery, where you can see the esophagus is connected to part of the intestines, bypassing the major part of the stomach and the duodenum, the outlet of the stomach into the intestines. And you can see there's not very much room for food to expand this pocket. Generally a very successful therapy. Liposuction, which was fairly popular in the past, is only cosmetic. It treats the symptoms only, and being that fat seems to be such an endocrine organ, and we're learning this now, we don't know what the effects are in communicating to the other tissues of the body what's going on in the fat depot. All of a sudden, when that message isn't there, there must be some disruption. So liposuction, not an effective surgical treatment. Now, it's important to acknowledge some weight management extremes. We've talked fairly liberally and at length about losing weight and ways to do that, but I want to advocate that the expectation isn't that everyone should do that, and if they do, they shouldn't do it to the extreme. It's important to have a clear sense and an unbiased, hopefully realistic sense of what your body image is. The body image is how you picture yourself through your mind's eye. And if you're like any other person in the class, there are things about yourself that don't particularly match the image that you have. Your perceptions, thoughts, attitudes towards your body might be different than you would hope they would be. And in some cases, this can provide motivation. In other cases, in extreme cases, it can cause a preoccupation with imperfections. And that can lead to compulsive behavior, extreme weight gain or weight loss, something that we call body dysmorphic disorder. Normally this centers around fat tissue, fat mass, being too fat, and might manifest as extreme fat loss, but there's also some indication that body dysmorphic disorder will apply to musculature as well, specifically muscle dysmorphia. And here I've labeled this term bigorexia. There's a really good brief 15-minute documentary by the BBC that I'll post in the resources and media page that I encourage you guys to go watch, that follows this fellow around to the gym and in his daily life and gets his take on his body image and how he lives up to his body image. His perception is that he's not muscular, he's not proportional, and that he'll always want to improve his physical stature. So a bit of a different take on the normal body image issue. When body dysmorphic disorder is extreme and all-consuming, it can lead to eating disorders, which really at their core are psychological disorders. It's an issue of perception and reality not matching up with perception. So at the core of all of these eating disorders that we'll talk about are severe disturbances in body image. Because of those severe disturbances, it often leads to extreme eating patterns and exercising patterns. More common ones are anorexia and bulimia. Nowadays, binge eating might even be more common, but it's not so hard and fast a division. There seem to be a spectrum of disorders along all of these three main types. So at the very core of this issue, it's a dissatisfaction with body weight. Now, interestingly, here heredity and environment play roles as well. Heredity can account for almost 50% of your likelihood to develop an eating disorder. And in cases where there's parental abuse or a parent has an eating disorder, those situations are equally likely to result in the child having a disorder as overly strict and regimented parents. So we're still trying to learn about all the sociocultural effects that impact these disorders. Certainly, it's a multifaceted problem that is quite difficult. Now, I'd like to make a disclaimer before we start discussing eating disorders. Some people might have had previous experience with these, or may be struggling with these issues in some way, shape, or form now. Some people might have strong opinions about these issues, and this is not meant to be a critique. This isn't meant to be opinion. This is just meant to lay out plainly what the diseases are and discuss some of the risk factors or the underpinning factors for each of these diseases. So with that out of the way, we can continue our talk about some of the more common eating disorders. The first of these is anorexia nervosa, which is characterized by an inability, a failure to eat food, a failure to eat enough food to maintain body weight. And only 1% of the population, according to some statistics, experiences some degree of this, but this is probably also self-reported, or in people that have sought help, it's possible that it's higher. Here, like with many other disorders, there's the fear of gaining weight and the craving to lose weight to prevent that from happening. This usually results in compulsive behavior and rituals surrounding food, hoarding food, not eating food, eating in private sometimes, and excessive exercise to correct for the potential weight gain that is perceived. And there's a lot of risks that are associated with a disorder like this, and they range from the mundane, like being cold, which is absolutely true. The alternate day fasting that I discussed with you previously, I tried a few times in my PhD to see what it was like, and one of the characteristic hallmarks of doing that is that you get incredibly cold because you don't have the energy required that you need to expend to burn food, to process food. There's also a risk of low blood pressure and passing out, gastrointestinal and immune disorders, so more likely to contract infections and disease. A psychological disorder at its root can have physical and further psychological effects, and if untreated, can lead to suicide. Bulimia nervosa is related slightly, but characterized by the intake and release of food. So binge eating followed by immediate remorse, immediate drastic remorse that causes the person to purge the food they just ate. Normally, symptoms and characteristics are very similar. There are rituals around food and eating in secret, but the associated feelings are strong and severe and force the person to act. Normally, these include shame, disgust, self-loathing, feeling emotionally drained after these feelings have persisted for a long time, and so the person is enticed to purge the food that they've just eaten, and this leads to a whole host of problems with dental issues, where stomach acid and sugar can erode the enamel on teeth. There can be rupture, ripping, tearing, breaking of the esophagus and the stomach. Again, the psychological issues, depression. Binge eating disorder is similarly a psychological problem that might share some of the characteristics with bulimia nervosa, but doesn't involve purging. Here, this is characterized by the uncontrollable consumption of food. The urge to eat is so strong in some people, and that's an evolutionary urge, that they can't help themselves. Often this is very rapid, uncontrolled eating, ravenous eating until uncomfortably full, not just stopping when the stomach says so. Often eating when not hungry as well. And normally this is a way of coping or escaping other stresses in life. It could be a way of coping with feeling like you are overweight. In that case, it's a self-perpetuating cycle and definitely is associated with high rates of depression and anxiety. So fairly severe characteristics associated with these disorders, and they're only disorders because we seem to be able to tease apart slight differences in how these manifest. But there does seem to be some gray area between these disorders. Some people may experience symptoms of one very periodically, infrequently, but not be fully diagnosable as having an eating disorder. This can happen with binge eating, just like it does with binge drinking, or the desire to purge after a particularly calorie-dense meal, the inability to control eating, and in some way, shape, or form, I think that many of us have probably experienced some of these characteristics. Treating eating disorders is inherently difficult. I don't think that there is one clear and fast way, and if these are issues for an individual, then counseling is probably the first and foremost route to obtain treatment. At the core of these diseases is a psychological issue, and so after addressing eating behaviors and the misuse of food, managing stress and emotion has to be the second issue. In these situations, reestablishing normal weight, certainly in the cases of anorexia and bulimia, is of vital importance to avoid any medical crises. But once a person is in relatively good health, the emotional and psychological cues for eating really need to be uncovered. What are the situations that prompt eating? What are the thinking patterns? What are the emotions? What are the things that trigger eating? It's difficult for any of us thinking inwardly to be able to do something like this. This really is where the common themes that we've talked about, realistic self-talk and having an adequate support network, can come in handy, if only to help direct you to somebody that can know answers like this and give quality advice. Often, though, being psychological problems on their own, self-talk is distorted. Oftentimes, people withdraw from their support networks and, like eating alone, tend to not socialize with other people. So how do we know what is the right weight, and is there a right weight? Really at its core, all of these weight management issues center around self-talk and support. We have to be able to acknowledge that there are individual differences in body composition and natural body weight for many individuals. That should, hopefully, give us the rationale and justification for living on a healthy lifestyle basis, not focusing on weight itself, but focusing on lifestyle, a balanced lifestyle where food is used for fuel, for growth, for pleasure, but not misused for any of those reasons. It's important using realistic self-talk and support to understand when limits have been reached. If weight management is a concern and you've embarked on a weight management program, there will be a time to end that program as well. It's important to know when limits have been reached and to reject unrealistic cultural ideas. Now, this is a difficult issue sometimes because cultural ideas are constantly being challenged, and perhaps rightly so. But often, this rejection of unrealistic cultural ideas can be used to justify binge eating or overeating or perhaps even undereating. There is a fine line between being justified in rejecting an unrealistic cultural idea and using that concept as an excuse to continue the misuse of food. So that will end our brief discussion on some more common eating disorders, ways that we can manage weight, reasons, potential reasons for body image issues in the first place, and our section on weight management. It's been a very high-level overview, and if you have any questions, please don't hesitate to ask. Otherwise, I will see you in class next week.